Yeah. Okay, so this video is actually going to be a on the field blood video. So what we want to do is discuss how we're going to take care of the athlete and get them back on the field as fast as possible. Okay, so first what we need to do is make sure that we have our adequate supplies. What I've laid out here is I want you to realize that we have our fanny pack here, and this is actually a good thing for the student athletic trainers to have, because then they can have supplies in here dealing with things like basic tape and things for first aid. Okay, so that's again a good thing to have. Now when we do have a blood situation, what we want to do is make sure that we always create that barrier, so we can use the universal precautions by putting gloves on. The interesting thing is sometimes you're in a situation where the athlete will be coming off the field and you notice that they are bleeding. You're just going to try to identify, where the blood is coming from, the wound, and maybe how bad it is. If it's something minor like a superficial abrasion, a lot of times we can get the athlete back on the field really quick. And this is also something too that we have to realize, that we've got the athlete that can maybe help us. They can be proactive by actually, if we gave them gauze to actually put on the wound so we could, again, identify things, we could have them help. We could also though have, if we have, other student athletes helping out too as well, we might have multiple people being able to do this job. However, the first thing though is make sure that you have your gloves on. So what we've done here is we've kind of created a model, and what we're looking at is saying, oh, this athlete is coming off the field with a bloody elbow. Okay. Now there's certain considerations to think of too, where if we're playing like on turf field, grass field, or even if it happened in some other area. Okay. Even on the dirt for that matter. Okay. So what I usually do is I always make sure that I've got a water bottle with me. So if I need to quickly, again, like maybe I've got to quickly identify by, spraying the water on it in order to look at the wound. Okay. Now, when the athlete though, when they first come off though, if they're going to be proactive and help, I might actually be giving them some gauze and tell them, here, take the gauze and put it on your wound while I'm then trying to get my gloves on. Okay, that type of thing. So I'm trying not to waste that much time. So if they're able then to do that, at least then we can have the direct pressure on there, and then it's not bleeding all over the place, depending upon again how bad it is. Okay, so as I got my gloves on, so then now I can go ahead and do my identification. So if they were helping out like this, then I'm sure, let's just take the gauze off. I generally will let it just fall to the ground, and I'll work around that, and I'll look at the wound. Like I said, so this is where I may then irrigate it if I need to, or if it's something where I need to at least get water on it so I can identify, again, maybe depth. If it's something superficial, I'm usually okay with, well, cool, let's go ahead and bandage it up and get them back in. If I've done water, I usually will take more gauze, and this is actually bulk non-sterile gauze. And everybody seems to trip out about using non-sterile gauze on a wound. Well, this is a dirty area. This won't really make much of a difference, and we're not going to clean this wound in a sterile setting and make it all sterile and have them go back and play where it's hot and sweaty and dirty and all that. We're focusing on, again, just quickly getting them back onto the field. This video is going to take more time to actually go over than the true time in order to get somebody on the field with a superficial wound. So if I did have it was wet, I'd take some more gauze. I generally, start down the arm to try to get, it dry. And then again, I'll just throw my gauze on the ground. And then what I like to use is, these are what are referred to as their non-stick gauze pads. Okay, different brands. I happen to use this one. I'm not, I don't get any, money from this company to, show their product. All right. So it depends upon, again, how big the wound is. I might use one or two pads. So let's say, just for instance, I'm going to use two. So I'll go ahead and open that up again. And then this is where, again, I can have the athlete help, or if I've got a student helping me where if they've got gloves on, they can go ahead and place them and hold them in place. So if you can, thank you very much. Now you have some options here. Sometimes you can use pre-wrap, right, in order to secure this, secure the pad. However, a lot of times I like to use, we purchase and use a lot of PowerFlex and Coflex. And so I find this stuff to be really easy to use. It's very quick, and I can get, like I said, the athlete back on the field super duper quick by, it's just getting those non-stick gauze pads on there, and then either or, so Coflex or PowerFlex. I actually happen to like the PowerFlex only because it tears a little bit better. The Coflex doesn't. But then that's also if you want to get technical and you want to make things precise, you can always then use a pair of bandage scissors. But I'm just going to start here with the Coflex, and then basically it's just securing the bandage, or the pad. So I'm going to start this way, right, and secure, and then spiral up the arm. The interesting thing about the elbow is a lot of times, where the bend is, I sometimes will go past the bend of the elbow through the joint and then come back around to secure it so it doesn't end up sliding off, okay? And then, so I'm just spiraling that on, and this is the type of tape that we've talked about in class where we can do the, here, I'll just cut it off there, where we can do the spiraling. And the cool thing about this type of tape, both the Coflex and the PowerFlex, is it doesn't have any really adhesive backing to it, but it sticks well to itself. So you're almost good enough here where I put it on like this, the athlete's ready to go, okay? They're ready to go back in. I don't need to use any athletic tape to secure it down. Like I said, it adheres wonderfully to itself. So I know this took a while to get to this point and talk about, how to do this, but in reality, you think, one, I get my barriers, right? Identify the wound. You could have the athlete use gauze to put at least on the wound in order to kind of control the bleeding. And then when you're ready, then go ahead, identify, see how bad the wound is. If you need to, irrigate it a little bit real quick, that's fine, do that. Then dry it off real quick with some more gauze. And then you're just gonna do your non-sticks. Get your non-sticks in place. Use your whatever tape you have, okay? So the question may come up though, hey, what if I don't have this special type of tape? And the answer is, okay, that's fine. You could use athletic tape. Just understand, remember, athletic tape doesn't, it doesn't allow for the muscles to contract. It's a type of tape that you don't want to use, what we call circumferential wrapping. This stuff is awesome for circumferential wrapping. But if you're going to use athletic tape, then you're going to do individual strips to kind of hold it into place, okay? So that's pretty much it for this little skill. So any questions, go ahead and leave it in the comments. All right, thanks.